When you dream of your new baby, you picture soft, flawless, porcelain skin, the kind they talk about in lotion commercials. But then reality hits around week 2 or 3. Suddenly, your beautiful baby's face is covered in angry red bumps or dry, scaly patches. It's incredibly stressful. You start Googling at 3 a.m. Is this an allergy? Did I eat something wrong? Is it my laundry detergent? Welcome back to our channel. Today, we are tackling the biggest confusion in infant skincare, baby acne versus eczema. These two conditions look shockingly similar to the untrained eye. But their causes, their timelines, and most importantly, their treatments are completely different. Treating one like the other can actually make things worse. By the end of this comprehensive 15-minute guide, you will be able to tell the difference with confidence and know exactly what to do. Let's start with definitions. First, baby acne. The medical term is neonatal cephalic pustulosis. Why does it happen? The leading theory is hormones. Before birth, your baby received a high dose of hormones from the mother. After birth, these hormones are still circulating in their tiny body. These hormones stimulate the baby's oil glands, causing them to get clogged and inflamed, just like teenage acne, but miniature. It's a temporary physiological state. Now, let's talk about eczema. The medical term is atopic dermatitis. This is a chronic condition. Think of healthy skin like a strong brick wall that keeps moisture in and irritants out. In babies with eczema, that brick wall is leaky. It doesn't hold moisture well, causing dryness, and it lets irritants, like soap, saliva, or dust mites, penetrate deeper, triggering an immune system reaction. That reaction is the red, itchy rash. This is the most important part. How do they look different? Baby acne looks like, well, acne. You will see distinct little red bumps, papules, and often tiny whiteheads, pustules. If you look closely, the skin right in between the pimples usually looks okay. Eczema looks different. It is rarely defined pimples. Instead, it looks like patches of dry, red, scaly, or crusty skin. It looks parched and angry. Next, let's look at location. Baby acne is almost exclusively found on the face, cheeks, nose, and forehead. Sometimes it appears on the neck or chest. Eczema also loves the face, especially the cheeks, but it also appears on the scalp. As the baby gets older, eczema tends to move to the creases, inside the elbows, and behind the knees. If you are still confused, look at the calendar. Timing is a huge clue. Baby acne typically appears early, between 2 and 4 weeks of age. Eczema generally appears a bit later. While it can start earlier, it typically doesn't fully develop until 2 to 6 months of age. If your 1-week-old has bumps, it's acne. If your 4-month-old suddenly develops a rash, it's more likely eczema. And now for the biggest differentiator, the itch test. Baby acne does not bother the baby. They don't feel it. It bothers you looking at it, but they're unaware. Eczema is the opposite. It is incredibly itchy and uncomfortable. You will see your baby rubbing their face on your shoulder or scratching at their skin because it feels tight and itchy. This is why knowing the difference matters. The treatments are opposites. For baby acne, the best treatment is usually benign neglect. You do nothing. Do not scrub it. Do not use adult acne creams. Do not apply heavy lotions or oils, which can clog the pores more. Just cleanse their face gently with warm water daily. It will resolve on its own in a few weeks. For eczema, you must be proactive. The goal is to repair that leaky brick wall. Moisturize relentlessly. Use thick, greasy ointments or creams, not thin lotions, at least twice a day, especially right after a bath to seal in water. Identify triggers. Switch to fragrance-free detergents. If it's severe, your pediatrician may prescribe a mild steroid cream. Let's summarize with a quick cheat sheet. Acne is bumps, starts early, doesn't itch, and needs no treatment. Eczema is dry patches, starts later, is very itchy, and needs intense moisturizing. You are doing great. Remember, both conditions are very common, and they do not mean you are doing a bad job cleaning your baby. Always consult your pediatrician for a definitive diagnosis. Always consult your pediatrician, especially if the rash looks infected. If this guide brought you peace of mind, please hit that like button and subscribe. In our next video, we will discuss cradle cap. See you then. Music fades out.